Anyone can experience mental health problems. Friends, family, and coworkers can make all the difference in a person's recovery process. You can help a family member, friend, or coworker by recognizing the signs of mental health problems and then connecting with them and helping to guide them to professional help. Connecting with another person by talking with them openly and non-judgmentally can be an opportunity to provide information, support, and guidance. This can lead to improved recognition of early signs of mental health problems, earlier treatment, and greater understanding and compassion. Unfortunately, many people fail to connect with a person who is experiencing an emotional health issue, even when they clearly see the signs. Let's take a moment to think about why. Why don't people speak up when they see others in distress? The most common reasons are a fear of invading someone's privacy, a perception that it is not allowed, or especially in the workplace, not businesslike to reach out, and finally, a lack of comfort and just not knowing how. Why don't people seek help on their own? When asked, most people report they don't want to admit that they are unwell, or they are afraid it will adversely affect their job. Many say they are embarrassed due to stigma about emotional distress and mental illness. Finally, some feel isolated and alone. Now that you understand the barriers that can prevent connecting, let's discuss the most helpful and appropriate ways to connect. If a family member, friend, or coworker is showing signs of a mental health problem or reaching out to you for help, you can offer support by simply expressing your concern and support. Remind the person that help is available and that mental health problems are common and treatable. Ask questions, listen to ideas, and be responsive when the topic of mental health problems come up. Reassure your family member, friend, or coworker that you care about him or her. Continue to include the person and invite him or her to all of the usual activities without being overbearing. It's also important to educate other people so they understand the facts about mental health problems and do not discriminate. Most importantly, treat people with mental health problems with respect, compassion, and empathy. These are general guidelines that will be helpful in almost all situations, but sometimes you may need a little help with how to start the conversation. Do you need more help starting a conversation about mental health? Try leading with these questions and make sure to actively listen to your employee, coworker, friend, or family member's response. I've been worried about you. Can we talk about what you are experiencing? If not, who are you comfortable talking to? What can I do to help you to talk about these issues with your parents or someone else who is responsible and cares about you? What else can I help you with? I am someone who cares and wants to listen. What do you want me to know about how you are feeling? Who or what has helped you deal with similar issues in the past? Sometimes talking to someone who has dealt with a similar experience helps. Do you know of others who have experienced these types of problems who you can talk with? It seems like you are going through a difficult time. How can I help you to find help? How can I help you find more information about mental health problems? I'm concerned about your safety. Have you thought about harming yourself or others? When talking about mental health problems, know how to connect people to help. Always communicate in a straightforward manner. Whenever possible, try to discuss the topic when and where the person feels safe and comfortable. Watch for reactions during the discussion and slow down or back up if the person becomes confused or looks upset. Most importantly, always remember that your role is not to diagnose or treat a person with a mental health problem. Your role is to support them and encourage them to seek the appropriate help.